healthcare, because it's a very important aspect in Nairobi, because there are times when city council dispensaries used to work, and this is the sources of primary healthcare in Nairobi. Nowadays is a very painful story. What is because Nairobi County has the advantage of being complemented by the national government in terms of the facilities around Nairobi, but for primary healthcare, what is your plan if you're elected governor?
The hospitals are ours, the doctors are ours, the drugs we are buying them. We can be able to subsidize the cost of healthcare for those people. So the first thing is health financing. Many people's lives get impoverished when one person gets sick. You know, you've worked as a family, you've put in some investments, you've moved on, then your mom gets sick and everything goes haywire because of not contributing for health insurance. So health financing is critical. Number two, the medical personnel, the human resource aspect of it. We don't have enough practitioners, and the ones we have been stuck at certain job groups. Many are not being paid, and I know them by name. I've sat again with them here, the health workers in Nairobi, clinical officers, the nurses, even before you get to the doctors. We must make sure that they're taken care of properly. Of course, you know, realistically, you know, we can't give them millions, but realistically, their CBAs have not been honored. They're demoralized, and they're the face, you know, they're the person who the Nairobi resident meets when you go to Pumwani. They're the one you meet when you go to whichever hospital. You find possibly in Pumwani, they don't even have a place to have lunch or tea when they're overnight, you know, when they're staying there overnight. There's no canteen. So take care of the human resource issue. Number three, the supply chain of pharmaceutical and non-pharmaceutical, you know, inputs. There's no private hospital that has a shortage of Panadol or an excess supply of malaria queen because of technology. Because once you know that we're dealing with this commercially, you must be able to tell that this part of the city requires this kind of drugs. That based on the information, and I spoke about a chip, we have information that people have been coming with this ailment, the stocks are being, you know, measured based on time, based on the demand. So we'll have to deal with our shortfall with KEMSA. I'm glad that even within Kenya Kwanza, we say that we'll deal with that monopoly, so to get drugs that are cheap price and available and accountable.